Hey, what's up guys? It's Beav with Tactical Baby Gear, and we're here with Dr. Webb today to answer some of our questions about babies. All right, Dr. Webb, you talked about breastfeeding and supplementing with formula and things like that. What are some of the advantages or disadvantages? I know it's a really hot topic, and some people are so pro breastfeeding, and it doesn't always work out for mom. The baby doesn't latch on, or doesn't work out, so you have to do formula, which a lot of times can kind of be heartbreaking for mom because they want it so bad. So what are your kind of thoughts on some of that?
The American Academy of Pediatrics is our, in a sense, kind of governing body. They're the ones that do all the research, and they feed us information that we can pass along to the parents and the moms. The main thing is that we feel that breastfeeding is the best for the baby. We like to try to get at least 4 to 6 months of exclusively breastfeeding, but certainly can go on past a year. It just depends on what the family is looking for, what the family expectations are, and what the limitations are. All of that being said, there are fine and nutritional supplements and formulas that can be used by the baby without harm to the baby. So one of the things that I look at when I'm talking to families is that making sure that you have this new child. This should not, we shouldn't add anything else in that makes it more difficult. If the breastfeeding isn't going as well as we want, if the baby is losing a little bit of weight and we need to do some formula, absolutely fine. We want to do what's best for the baby. We don't want to be so strict with how that we're going to do things. We want that baby to be healthy, and if sometimes that means doing a little bit of formula right at the beginning, no worries there. Lactation consultants are great. They help out with mom. They work with them in the hospital. You can work with them outside the hospital.
Maybe always got cool little tricks or something.
Right. And one of the most difficult things is that the parents feel like once they're out of the hospital that's it, they don't have any of the support. And there are many lactation consultants who will come to the office. We have our own here in our office that'll sit down with the parents. Many of them will even come to the house to help the parents out so that they get that additional help in a more comfortable environment.
Right, a little bit less stressful. Everybody's at calm and at ease.
Right, and so the more anxiety and worry that potentially mom has about all of this, the more difficult the breastfeeding is going to be, the more difficult it is for the body to relax and allow the natural process to happen. So it's really important that as a parent, again, like I said, this should be an enjoyable time and to relax and be able to spend time with the baby and not be so worried about all of the small details, because there is support. There's family, there's the lactation consultant, nurses, doctors, everybody's around to help out.
Right, cool, awesome, good stuff.